If your child isn't moving and you suspect they might be unconscious, you need to calmly come in, check for danger, check for response, speak to them, and then touch them. So you would pinch them gently or touch their shoulders to see if there is any form of a response. You're looking for anything at all, so a tiny flicker of the eyelid, that would suggest that they are actually conscious and then breathing, which is good to know. If you don't get any response, you need to tilt the head and lift their chin to check if they're breathing. So you're opening the airway this way, then you're putting your cheek above their mouth and nose, you're looking down the body, you are looking, listening and feeling for at least 2 breaths in a 10-second period. If you don't see two breaths in a 10-second period, they are not breathing. So you need to start CPR quickly. CPR is cardiopulmonary resuscitation. With CPR, you are being the heart and lung for them. When you are breathing into them, you are being the lungs. When you're pushing on the chest, you are being the heart. So you are being a heart and lung machine, you are keeping them alive and you're keeping the brain and the heart full of oxygenated blood. So you've checked for danger, you've checked for response, you've opened the airway, you've checked for breathing, they're not breathing. You then straight away for a child need to start with 5 breaths because children don't retain the oxygenated blood in their system like an adult does. So you need to tilt the head, lift the chin, hold the nose and breathe in 5 times. Doing that, you're reoxygenating the blood so that when you are pushing on the chest, you are then circulating the blood round to the heart and the brain. So when you are doing this, you are compressing the heart by pushing on the ribs, pushing down to circulate that blood. Okay, so you're going to be doing 30 compressions, pushing down about 1/3 of the depth of the chest, about 5 centimetres, and circulating that blood. 30 compressions, and then you're going to give 2 breaths. And then back to the compressions again. And you need to keep going. You phone an ambulance for a child when you've done 1 minute CPR.